Welcome to our podcast. I'm Brent Dodge, and I have with me Linsey Olson, a physical therapist at Alpine Physical Therapy. How you doing, Linsey?
Doing well.
Linsey is here to talk to us today about kneecap problems, the scientific term of which is patellofemoral tracking dysfunction. Basically, kneecap problems. Let's keep it simple. Linsey, you've been a physical therapist now for 6 years.
Almost 6 years, yeah.
What percentage of patients in those years do you think have come in with knee pain and knee problems specific to the kneecap?
You know, it seems like when I see a patient who has had knee problems or even hip or ankle problems, they tend to have a patellofemoral or a kneecap component to that. So I would say of my knee patients I've seen over the years, I would say at least 60 to 75% have had a patellofemoral component to their problem.
And I'm the same way in the clinic. I mean, people come in so many times, or even if I see them on the street and I'm talking with them, they're telling me about pain that they have in the front of their knee, particularly with going down hills, going downstairs, and you think, how long have you had that? Yeah. And they'll say, oh, I thought that was something that came with age.
Something you're supposed to, something
exactly.
you're having to live with, yeah.
And if all the diagnoses I've seen, that's one that people seem to think is just par for the course.
Just have to deal with it. But there are ways that we can treat it, and there are lots of different ways we can go about treating that specific problem. Whether you do have a hip problem or a different knee problem, we can help with some of that anterior knee pain.
So there are some things that you're looking for when you hear somebody voice a complaint about, potential kneecap problems. Are there other directions that you might go?
Right away I ask them, what are their specific symptoms? Do they have frontal knee pain or lateral on the outside knee pain? Do they have any popping with that knee pain? That's something that can allude a lot to a patellofemoral problem. And again, looking at a lot of what they do for activity when they're having that knee pain specifically.
Okay, so you kind of narrowed it down. You're thinking, whether hip, ankle, this guy or gal has a potential kneecap problem. What steps do you take to potentially treat that problem?
So first I'm going to assess, what's happening in the kneecap. I'm going to assess how that knee is tracking. Is it moving up and down as it should? Is it pulled to the outside, which is a common fault of the kneecap? And then from there into treatment, there's a couple different things we can do. We can mobilize the patella, the kneecap, to get it moving better, whether it's needing to move inward or needing to move upward, or it has a tilt to it. So we can do that. We can also tape it in a certain position so that it's staying in the position we want it to with activity. There are different kind of braces we can do, as well as we can work on that inflammatory component with different things we do in here.
Now, I've heard a lot, too, about the use of orthotics as possibly changing the way that the kneecap lines up. Do you find much help with those?
I do. I find a lot of help with orthotics in general for a lot of different conditions, but especially this, it can realign the way the knee is positioned and create a lot more comfort for the knee. And then if the joint underneath is lined up well, then that patella is going to move better. And
you did mention something about taping. I mean, what types of tape do you use, and how effective can that be?
We use a couple different types of tape, but the specific one that we would use is called Endura tape, and it has a little bit heavier of a component. It's a little bit tighter, and it holds the joint in a certain position.
Now, is this something people have to come to physical therapy to do, or can you teach them how to do it on their own?
Yep, it works well to do it a couple times in the clinic, see if it works for them with what they're doing, and then eventually we can teach them the technique. They can buy the tape on their own and do it on their own. So it is a nice technique for people.
Is the tape something that most people will have to use long term, or is this more of a mid-range solution?
It depends. I'd like people to not have to tape for the rest of their lives. If they have to and it gets rid of their pain, then so be it. They are pain-free and functional with what they're doing. But for the majority of people, if we can get the kneecap moving and get the muscles surrounding the kneecap performing better and performing correctly, we can correct that problem, and then they don't have to tape long term. So there's a lot of other components to it.
Well, I was just thinking about a time in my life where I'd actually had a hip problem, and it curtailed any kind of running, any kind of activity, to the point I got kind of deconditioned. Wasn't working out, and finally got the hip problem taken care of through the help of a physical therapist. And as soon as I started back into my running and other activities, I ended up with kneecap pain on both sides. Is there anything that you would tell our viewers about that kind of a kneecap problem?
Well, one, I'd talk to you about returning to activity, how quickly you return to activity after being deconditioned, how, what type of surfaces were you running on, what was going on there. With both knees going that direction, I'd want to do a full exam on both, the entire lower extremity on both sides, and I'd want to take a look at your back. What's happening at your back, what's happening at your hips, and go from there.
Some of the kneecap pain that people talk about may not just be a knee problem. It
may not be a simple knee problem. It may be something referred from the hip. It may be something referred from the back. It can get pretty complicated with that, or it may be both.
Well, I want to say thanks to Linsey for coming out and talking to us about kneecap problems, and I know you're just waiting for the tip of the day.
Here's today's tip of the day. You don't have to live with knee pain. If you're having some sort of kneecap pain in and around the kneecap, or even pain on the outside of your knees, you don't have to live with it. There are things you can be doing to get it better, very simple things that we can do to get you on your way, to keep you active and happy in your daily life.
I'd like to say thanks again to Linsey for coming out and talking with us about kneecap problems. If you have any additional questions on this topic, be sure to visit our website, and in particular, click on Patient Resources. And for additional information, feel free to call our clinics.